Well, hello. We're here to talk today about compliance. It's something that everyone in the behavioral health organization platform has to deal with, has to really make sure that they're on top of. And if you're somebody that has been on that kind of hamster wheel of every year freaking out because that audit process is coming up, or worried about if your processes are happening behind the scenes, then we've got some great information that we're going to talk about today when it comes to Simplifyance, their software, their services, their accreditation services, and their ongoing consulting services. So to help us out with that today, we've got Jess with us. So Jess, for anybody that doesn't know you, go ahead and introduce yourself and tell us what you do over at Simplifyance.
Thanks, Danny. My name is Jess Ortega, formerly Barry, for those of you that knew me as Jess Barry. My married name is Ortega, and I am the Director of Sales here at Simplifyance. So I oversee all of our entire sales department.
Well, I think I speak for everybody that's going to watch this live today. You are absurdly respected in the behavioral health field. You've had a great career. Give us a quick update for anybody that doesn't know. Kind of fast forward where you used to be, where you're at now, and why it matters so much in the life that you're building at the moment.
Absolutely. Well, I think people know me most as the Director of Business Development at Sandstone Care. Still a huge raving fan, but left last spring and decided to take some time off to be with my little one over the summer. So took a few months off. My son Dexter is going on 17 months, and man, has it been a wild ride and just incredibly fulfilling. So I got linked up with Parker last fall, Parker Smith, our CEO and founder, and absolutely fell in love with Simplifyance and just had to be part of this thing. So here I am.
I love it. I love it. And welcome to this side of the fence, right? You're not worried about all the other stuff on the treatment side. You get to have a different phase of life, which is always excitable. And enjoy that little one. I think I can speak for everybody who has kids that this is just an enjoyable ride. So enjoy it.
Thank you.
Um, all right, so let's hop into some of the offerings today. So again, if you're watching and compliance is just a really pain point for you, I want you to pay attention today because we're going to take a deep dive. But Jess, for anybody that's not familiar with Simplifyance or what they do, can you give a brief overview of their product offerings and the things that they do unique in this field?
Absolutely. So, really, here at Simplifyance, we're a compliance solutions company. Our mission is to support the growth, development, and refinement of behavioral healthcare organizations striving to make a positive impact in the lives of others. Um, our vision is truly a higher standard of quality in healthcare. And we do that in a couple of different ways. So, we support folks, organizations with licensing and accreditation consulting. We have a one of a kind software compliance solution, and we also have an added on continuous compliance subscription for ongoing compliance consulting support for organizations, which I'm excited to talk about today.
I love it. And we've got some people hopping on with us live today. And I want to encourage you. The reason we do this live is because if you have a question, a comment, a concern, something that you want answered, I want to encourage you to drop it in the comments. That way, whether it's live or in the replay, we can follow up. But we've got Gina with us today. Welcome back, Jess. Glad to have you as a part of the Simplifyance team. Parker's here. Jeremy is here. Gwen and Quilin, I believe I said that right. So welcome, everybody. Thanks for being a part of this broadcast today. So when it comes to common problems faced by organizations like, time-consuming chart audits and maintaining compliance, how does Simplifyance really kind of mesh into a lot of those pain points for behavioral health organizations?
Well, Simplifyance is truly a compliance solution to the grueling number of tasks that someone in an operations or compliance or clinical role has to deal with on a day to day basis. The software helps streamline all of the regulatory responsibilities from the state requirements, your accrediting body requirements, as well as even insurance payer requirements, and help support organizations in remaining in perpetual daily compliance. So it is, like I said, one of a kind. It takes all the headache, a lot, well, most of the headache out of managing compliance. And it does so in um, transitioning organizations from being a piecemeal, uh, um, task oriented, trying to have things on the share drive, have binders full of policy and procedure, have uh, you know five hands in the pot or none of the hands in the pot with compliance, and it is truly a streamlined solution to managing day-to-day compliance activities.
Yeah, and we're going to keep talking about software for a minute, but stick around. If you're somebody that is like, well, I got my director of clinical services doing this. I don't know if she can continue it because she's getting busy or he's getting busy. Well, we're going to cover sort of their ongoing compliance services as well. So there's a solution for you. So stick around if that's you and you want to hear a little more about that. But um, here's a main problem that a lot of organizations have, and it's reporting incidents, right? A
Mhm.
lot of organizations are great at reporting incidents, but we find that there's typically a problem with following up in a timely manner. Can you explain how the software kind of even helps with that?
Yeah, so it's a best in class incident management tool. Like you said, a lot of organizations initially will enter in their incident into whatever EMR, EHR that they typically track the incident management in. And the follow up does go to the wayside. This can oftentimes just be because, especially the 24/7 facility, there are a lot of competing priorities and stressful things going on. So they could pile up or never get back followed up on. And so the software really closes the loop and creates a accountability loop. So when you submit your incident or medication error initially, it goes into the system. It can at that point then be assigned to the appropriate department for follow up, and a dynamic follow up form pops up by the touch of a button on your phone, your tablet, your computer to complete that follow up on the incident and submit it. And then it stores it there for regulators or folks that will be looking for those later down the line during an audit. So um, the coolest feature about this, though, is that all of that data aggregates out to a reporting function. We talk here about how, incident management incidents are really the mulch for the growth of the organization. And so understanding those trends and really helping those making sure that those trends and all that data informs your performance improvement plan is what the regulators want to see, and ultimately at the end of the day it's what makes your organization continue to grow and be healthier and better serve your clients and then at the end of the day.
Yeah, I love it. And one other thing that I want to make sure people know is a lot of those supervision forms are also housed in the software, correct?
Yeah, so that's a new feature that's really, really cool. So we have a sort of sidecar to your HRIS system that helps collect and house all of the compliance related documents for your staff. And this is also an area that can house your supervision forms. And what's really neat about that is you can quantify different things you want to measure. So, for example, if you're wanting to work with a clinician on timeliness or quality of clinical documentation, you can have a 0 to 10 on their supervision form, and each week you're talking through and you're rating them on 0 to 10 on quality of notes, 0 to 72 hours on timeliness of notes, and then actually just press the button for the reporting and look at monthly, quarterly, or yearly trends. Is that clinician progressing or digressing based on your weekly supervision numbers? And that can certainly help inform performance improvement for individual team members as well.
Yeah, so what I'm hearing is there can actually be a link in the software between incidents and through those supervisions, right?
Yeah,
That you can find
any
those links.
Absolutely. Any of the data, and we have lots of dynamic forms that are collecting all of the compliance data that are really important and that you want to know in order to help inform the growth of your organization, is auto aggregated. And you can even make your own form. So if there's something that you want to measure that isn't out of the box from our software, you can create your own form and be able to again auto aggregate that out to reporting function.
Yeah, I love it. And Braden Smith says good incident management is necessary for organizational health. Great job describing how this works, Jess. Yeah. Um, and really, we'll touch on that just a brief second because Braden brought it up. But talk about organizational health at a very high level and just how incident management can kind of help out with that.
Yeah. So, I mean, again, going back to the software provides organizational health, not just through incident management, but
Hmm.
also through the other key features that it offers. Um, it serves as a repository and houses all of your policy and procedures and the version history of those. So every time you update a policy or a procedure or plan, that version is stored and the new version is also stored. That's outward facing to your organization. So a healthy organization has policies and procedures that are accessible and that are updated in a timely fashion. In addition to that, one of the headaches we hear about is, oh, okay, so I updated the policy and now I've got to print out this document and hand it out to everybody so that they can sign it saying that they've reviewed and they understand the new policy update. And then I've got to take that form and I've got to scan and email it into this share drive, and it's just like all this crazy making busy work. What's really neat about the software is you literally, your new policy gets published, your staff get notified by text or email, and a box pops up, 4-digit pin to attest that you have seen, reviewed, and understand the policy, and that's housed in the software, and you move on. So again, when we're talking about the health of an organization, we're talking about making compliance easy for people to do. It's not that anybody doesn't want to be in compliant, it's that it's hard. Um, Especially with prior to having a formal structure and way to streamline all of these tasks and responsibilities. So that brings me to kind of the third component of the software, which is the task management. Um, there are over 100 tasks that are required for the Joint Commission alone in order to stay on top of your compliance daily, from fire drills to environmental care rounds to HR checklist. I mean, there's updating infection control plans. There's so many things, and this usually lives in somebody's calendar or in somebody's mind in some cases, which is, it can be, there's not institutional knowledge built there in that case. But it also really keeps you from being able to uh, delegate the tasks that are needed and see what's being followed up on, what's upcoming, and what's late. The software shows you exactly real time. Okay, this is what's coming up and due based on the timeline of the Joint Commission or the state or both or CARF, and this is what's coming up. This is what you've done, and you can delegate those tasks to the appropriate departments, as I said. So task management, along with policies and procedures and incident management, all of these things combined are really the sign of a healthy organization. At any time, you should be able to be like, I know exactly what's going on with my compliance, and without an easy way to manage that, it's just very difficult to say, or just one person in the organization knows.
Yeah, and
Usually.
what happens if that one person leaves, right? So this is more of a streamlined process that's going to be with the organization, grow with the organization, grow with changes. Let's be honest, people move jobs, people move on. It's part of generally employment ecosystem at large. So it's a great way to keep things central. So we're going to move on to really talking about your add-on service, but I want to encourage anyone, Jess will and her team will do demos for you for this software to show you how it works and help you decide if it's a great fit for your organization where you're at now. So if you'd like to learn more, you can contact Jess at the number below, 720-679-2345, or visit online at simplifyance.com, and you can get yourself a quick little demo just to kind of go over all of these features that Jess is talking about so you can get an idea of how these works. But so that's one aspect of the leg. We have our software, we have sort of your ongoing continuous compliance service, and then we're going to talk about accreditation as well, which is the third leg of what Simplifyance does. But so we've got a great software, but now we have an organization that is just, they don't want it necessarily in-house. Talk about your continuous compliance add-on service and why people seem to rave and love it.
Yeah, continuous compliance is a really neat feature, add-on feature to the software. So some smaller organizations will outsource as little as 2 hours a month for us to help support any of their compliance tasks that they just need support with, whether it's updating policies or helping to inform a performance improvement plan or a QAPI meeting and how that's supposed to look and how it's supposed to be run. We definitely, I mean, there's a huge menu of items that can be outsourced to us, even as simple as chart audits. Like you could outsource that to us. So smaller organizations, look at that 2 to 3 hours a month. And then on the other end of the spectrum, we have organizations that actually outsource their entire compliance department to us, and you have a team of experts who are truly like staff of your organization that are managing all aspects of compliance. So you kind of can have, based on your organizational needs, you can have just a little bit of support ad hoc. You got a question, you pick up the phone, and you can call us and we can answer that question for you. Um, and or have us actually be the experts in your company. I always laugh and say, who oversees the compliance person? Like, who's smarter than the compliance person? Probably, nobody knows compliance better than the compliance person in most organizations. So it's definitely helpful to have that expertise.
Yeah, and there's some organizations that don't really have a compliance person, right? It's just somebody that's got another hat on that has to do two jobs at the time audit process comes around, which can make it just really ineffective, especially if this is a clinical person that you really rely on to really manage
Mhm.
clinical and oversee clinical at your location. So, Jess, when it comes to this add-on service, is this something that you say is really only for someone that is a large organization? Is this somebody that's a brand new treatment center that's like, hey, I'd like to get this right off the bat moving? Who is this really a good fit for?
All of the above. So, a small organization, like you mentioned, or maybe a new organization who the clinical director, program director is the person that's really overseeing the majority of the compliance responsibilities, that really needs that support and really needs a place to, like, again, pick up the phone and call when they have a question and they're trying to figure this whole thing out. The mid-sized treatment center as well that might have a compliance person that is wearing a lot of hats or doing a lot of things, and their time isn't as efficient as it could be. So they would be best suited with some support, a couple hours a month for whatever tasks are at hand that they need some project-based support on. And then again, the large organization is, we're their people, we're their compliance experts. And so, regardless of the size of your organization, the levels of care that you offer, the continuous compliance subscription, it's a 12-month subscription, is a really, really great feature for organizations of all sizes.
Yeah, and we'll talk about the CEO that really just enjoys not worrying about this in a second. But Nikki said the ability to keep compliance activities, schedule, and deliverables documentation centralized and organized in the case key staff person leaves the organization is huge. Yeah, Nikki, we talked about that. It's like, yeah, you said, Jess, who knows more than your compliance person? Well, what happens if that compliance person moves on? So the ability to
Mhm.
keep all of this centralized in one place so that we all, I remember back in the day, I used to use a paper calendar, and if I didn't have it on me, I didn't know what I was doing. And then one day, these beautiful phones came along with integrated calendars, and no matter where I'm at, someone can say, Danny, what are you doing today? And I can say, oh, this is what I'm doing, or this is what I'm doing next month. And to make that correlation, it's just that centralized spot where everything is, where you can do everything, where it's easy for you to go in and get. And again, that's more about the software, but that continuous compliance process is huge. And you had mentioned something a little bit about it kind of integrating with the work calendar so they can know what's coming up. Can you explain a little bit about that?
Yeah, so the task management portion of the software, they are hyperlinks that live in your calendar, your work calendar. So,
Mhm.
for example, if you have a fire drill coming up, you click the hyperlink of fire drill in your personal work calendar, and it opens up the form to complete the fire drill. So that integration is super nice. So you're not like having to keep the Simplifyance calendar up or be logged in constantly to the software to know what's going on. Like it's just automatically in your calendar, which is really nice. The other thing I wanted to also mention about going back to continuous compliance and our software is, in addition to us doing the legwork and helping support the task management, the things that need to be done, we're also teaching and we're trying to bring a culture of compliance to every organization we work with. So there's a lot of knowledge transfer and supporting staff at various levels in the organization to create this culture of safety and compliance. That's our vision. That's what we're here to do. So we're not just doing the heavy lifting. We're also teaching a man to fish, so to speak.
Which is a big deal because this is information that is critically important to offering services, continuing to offering services, and being in compliance with all of the things that you need to be in compliance with. Um, which takes us to sort of our third leg of the business, which is this licensing and accreditation consulting. Can you explain a little bit more about what Simplifyance does and how they support organizations of all levels through that process?
Yeah, so I'll start by saying the one of the things that I love about Simplifyance is that we're all full-time employees. So we're not a bunch of contractors. We really care about the work that we do with organizations and helping them be successful. Not that consultants don't, but we really have a buy-in as a team of helping bring organizations along, whether they're just getting started out or they need some help with renewal surveys. So our consultants that are full-time employees that work with licensing and accreditation do just that for folks that are just starting their treatment center up. Perhaps they've got their vision and their capital and they need some help with actual licensing and getting accredited. So we help lots of organizations get started that way. We've also helped a lot of organizations with expanding services. So, for example, if they've been providing substance use disorder services and want to expand into primary mental health services, there's some licensing and things that need to be done on the regulatory end of things, and we can help not only do the due diligence and research of that, but coach and support and prepare for that additional license. And then for organizations that have already received their state license and accreditation from whatever joint commission, CARF, whatever accrediting body that they are accredited by, a lot of times we get calls for some gap analysis work. So, you pass your first or your second survey, things are going great, and okay, I put a lot of work in and I'm taking my foot off the gas now to catch my breath. And during that time, things can fall by the wayside as you're operating again a business that pulls on a lot of emotions and heart and crisis management most of the time. Um, so understandably can fall to the wayside, and so we'll get calls from organizations that have a sense that things are okay, but they don't really know what they don't know. They're not super pumped on their policies. They feel like they need to be refined, or they have specific questions about maybe places where they know they've fallen out of compliance and they need to get back into compliance. So we can help consult on that gap analysis support. mock surveys, getting them all prepared so that they can go and crush their surveys. We have an amazing track record of every organizations we've worked with have had 5 findings or less with the Joint Commission, and we're very proud of that statistic, and hope to continue to just work with organizations that are passionate about doing things the right way, getting things buttoned up, and then putting it on autopilot, honestly, with our software, because that's what it does. You spend all this money, you invest in consultants to get you where you need to be, and then if you implement a process and an autopilot, sort of auto managed way of addressing all of those responsibilities, then you won't need to make that call 3 years later and say, "Hey, I need help with my gaps." Um, so we help on the front end for those that are looking at expanding services, or for those that just want to do some mock preparation for renewals.
Got it. So great service, like really game changer. I know when Parker kind of founded this company, he had already come from an experience of being absurdly passionate about compliance. Like, right? Like we all have our nerd zones that we care deeply about certain things that others don't. And what I love about Parker is this just happens to be his happy place where he gets to bring all of you with him, where he had this dream of really this sort of ecosystem, right? The Simplifyance logo is done in a certain way in which it's sort of this ecosystem feeling, this kind of water flowing through a river in a way, because he understands how important overall this part of the business is when it comes to not only just staying open, right? But this is directly contributes to the health and well-being and happiness of your team. The incident reporting, finding out where things need fixed, or problems that are arising over and over to make not only a better organization, but a better experience for the people going through your program, correct?
100%. I mean, it does trickle all the way down. Healthy compliance, being on top of your compliance, having a culture of safety and compliance where it's everybody's responsibility in the organization, not only provides happier staff and happier clients, but it makes things more efficient. You save time, you save money, a lot of money in that respect. And, you know, like you can feel good knowing that you're if you're a clinician, if you're delivering direct services, you're not only doing your best at with your skill set, you can hang your hat knowing that you work for an organization that's doing their very best in the daily upkeep of their regulatory responsibilities, which again is something that can be easily put to the end of the list when we're trying to save lives, but directly impacts those lives being saved by virtue of staying on top of it and creating a better way of managing compliance. Because in our industry, the way we're doing it now is just it's just not the best way, and we can
Mhm.
we can do better.
Yeah, and that's the beginning of what Simplifyance wants to have. The impact it wants to have on the behavioral health field in general is a better, more streamlined process. So let's talk a little bit about the consulting services and how people can kind of get involved. Um, Talk a little bit about what it costs to kind of get started and start working with Simplifyance.
Well, yeah, specifically in consulting.
Yeah, let's talk about consulting. Yeah, let's talk about consulting services specifically.
Yeah, so I mean, really what we wanna do with any organization, whether you're looking at consulting or software or anything, is go through a thorough needs assessment and really understand what are the current processes, what are your current resources, and understand how the business is running.
Mhm,
From there, then we can curate a proposal that outlines our recommendations and with a timeline to get you where you want to be. So really, what I would say is that if you bring us your vision, we want to take your vision and back it into goals that are going to get you there. So the pricing certainly varies depending on what your compliance goals are.
mhm,
But I will say that being that we are a disruptor in the industry, truly,
mhm.
we really want to be accessible to all organizations. So we meet people where they're at and make sure that we can help support them at whatever capacity they're able to invest.
Got it. And then let's touch on a little bit about software pricing, right? Software is your game changer. This is the glue. This is the thing that keeps it all together, keeps it all in one place, makes an organization run smoother. Can you share a little bit about pricing on software?
Yeah, definitely. So currently as it stands now, um, if you're a non 24/7 facility or an IOP PHP program, the software is $250 a month. And if you're a 24/7 facility, such as a detox or residential level of care, it's $500 a month. These prices are going up to $299 and $599 June 1st. So we would love to talk with you before then if you are interested, so that you can take advantage of those savings. But yeah, it's I mean, again, personally, going back to when I first learned about Simplifyance, I was like, man, we're giving this away. And we are because we want to help make compliance, raising the bar in this industry accessible. Like I said, there are one-time implementation fees for the software, and that is to load in all of the data and do some coaching and helping support the implementation process, which I will say we've all been through really hard implementations, especially with EMRs or integrating to new platforms. And I am here to say that our implementation is a dream compared to a lot of those other ones out there. So an easier implementation process, and we have a couple different levels for that. So for a very small organization, again, our commitment to being accessible, we want to make it affordable for people. For a smaller organization with 1 to 5 employees, our implementation fee is $2,500. Again, that's one time, and it gets all the data, all your policy procedure, creates your profile, gets everybody logged in, and rocking and rolling, and then you can just like you can go. It's out of the box, ready to go. There's not any consulting support with that, so it's not our recommended level. But if you're a small um, organization, it's definitely an affordable option.
Mhm.
Our recommended implementation level is $5,000 one time, and that's for anyone 5 to about 100 employees, um, with maybe 1 to 3 locations. This implementation process includes 15 hours of software consulting with our consultant, so that they can not only help make the software specific to your needs of your organization. We can create dynamic forms together, make sure we're pulling the data and capturing the data that is really specific to your organization. Those 15 hours of consulting happen during the first 90 days of implementation. And it really is a cool opportunity to take an awesome product out of the box and just like make it more specialized for your organization. And then the third tier is an enterprise tier. So if you have, 150 or more employees with lots of locations, that enterprise level starts around $10,000. That's really building out a specific instance for your organization, for your specific goals and needs to all of your locations nationwide. And we have a special proposal for based on your size and your needs, starting at 10,000.
I love it.
So I will also just mention one more promotion at
Ooh,
the
promotions, savings, pay attention.
I don't want to sound too salesy here, but I want to make sure that you guys know about it because it's cool.
Yeah.
Um, so we are running a $1,500 discount on all of our implementation fees right now.
Mhm.
So the $2,500 basic is 1,000, 3,500 for our recommended level instead of 5,000, and of course, if you're enterprise, that will be a customized pricing, but we'll also be able to take advantage of that discount. And that is at least through the end of May,
Mhm.
perhaps a little longer, but I'm not sure. Definitely, again, if you're watching this and you want to look at the software and implement it, let's talk before June.
Yeah, I mean, if you're somebody that's already on the fence, kind of, should we do this? Should we not do this? I think this is like, hey, let's save a little bit of money and just, pull the trigger and get this process started. So no, that's a great thing to share. We got a comment that asked, is this a pay per seat software?
Oh, good question. No, it's not. And thank you for asking it because that's probably one of the biggest differentiators of our platform is that we're not paper seat. You know, paper seat models would, in this case, probably discourage folks from using the compliance software. We really want to encourage, again, a culture of safety and compliance in organizations. So, unlimited users, 250 a month for an IOP, 500 a month for an RTC or detox.
Yeah, I love it. Extensive, Jess. Like you are always extensive. You covered everything. You did a great job today.
Thank
Um, And again, I want to encourage you if you're watching either live or in a future replay, the best way to really kind of get the process started is to either visit simplifyance.com or again, contact Jess directly at 720-679-2345 for a demo or to get any of your questions answered. That's the best way to kind of get the ball rolling. And, maybe you're just in the information fact finding stage. That's fantastic too. Simplifyance is really interested in being a partner with you, whether it's a buying decision you want to make now or you're interested in making 12 months from now. Don't be worried about picking up the phone and reaching out and getting some of your questions answered. There may be some great insight that you have that maybe Simplifyance needs to consider. So that's why that collaboration and that communication is so important because, Jess, you love to hear from people in the community. And before we go, I want you to share about that CEO story and how excited he was to not have to worry about this.
Yeah, it was such a huge compliment. I spoke with a gentleman in the community, a CEO here in Colorado last week, and I said, "Oh, how are you feeling about your survey coming up?" And he was like, "No problem. Not even worried about it. The software, I know exactly where we stand every day with our compliance, so there will be no surprises. I feel it's the best I've ever felt." And I was like, what a huge compliment. I mean, that's what we're here to do, right? Is to change this culture of, oh my gosh, the regulators are coming, to, hey, I'm excited to show off my program and how we are in perpetual compliance. And that's exactly what his experience was. And, it filled my cup because I thought, hey, you know what? This is what we're here to do and we're doing it. And that was really cool. So hats off to him and appreciate that feedback and hope to help lots of other organizations that want to have a similar experience of not sweating that survey date.
Again, I know that. I've been in that. I've been in those buildings when that happens. It's just not a pretty thing. And I agree with you. Let's let that stress just fall off and just
Yeah,
know, oh, they're coming tomorrow. Okay, we're good. No big deal.
totally, totally.
Well, again, thanks for your time today, audience. People who are watching and commenting, thank you so much for being here and making this interactive today and really providing some great questions, right? That's not only, I firmly believe there are no dumb questions. If it's a question mark in your mind, it's likely a question mark in someone else's mind. So asking is always great. So even if you're catching this in the replay or watching this later down the road, comment, let us know, and we will work these comment section and make sure that we answer back to you. So again, Jess, thank you for your time today. Thank you for breaking down kind of the three legs of this business. Your consulting services, your add-on, your software, all those things that Simplifyance does to make sure that behavioral health organizations kind of run smooth and fluidly. So appreciate your time and information today, as always, Jess.
Yeah, thank you so much. It's been a pleasure, and I hope to. If I haven't connected with you recently, I hope to get reconnected soon. It's great to be back in the industry, and yeah, I just appreciate everyone who tuned in today.
Awesome. If you need more or want more information, simplifyance.com. Have a great day, everybody. Still signing off.